Hello. All right. Hi, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Monday, April 26th. Here to give you an update on the impact of the COVID-19 epidemic in Mobile County and talk a little bit about our vaccination efforts. So rather than focusing on the worldwide numbers, if I can just focus on what's going on in Mobile County right now, because we are starting to see increases where we saw very, very, very low numbers following our big spike in December and January, probably due to gatherings and transmission that occurred around Easter and spring break. So let's get right to what's happening in Mobile County. So yesterday we added just 16 cases, taking our total number of COVID-19 cases related to this pandemic to 40,668. 802 people have died. One additional death was added yesterday, and 7 people were newly hospitalized yesterday with COVID. That brings our cumulative total of number of hospitalized to 4,897. And then yesterday, the number of people hospitalized, everyone hospitalized for COVID-19 went up 4 to 25. So we're seeing the number of hospitalized on any given day right there in the mid-20s. It dipped a little bit over the weekend, but again, it had been inching up weekly for the last 4 weeks. So then if you look at our weekly expanded report, then particularly looking at figure 2B, where we provide the count of COVID-19 cases by week using that infectious date instead of the report date. So again, this is the date that the person was most likely infectious. It's either the date of illness onset, the date of specimen collection, or the first report to public health, whichever is earlier. So if you look at figure 2B, you can see that last week, 345 confirmed and probable cases of COVID occurred. 345 people were infectious last week, and that number is twice what it was the week before. So we had a doubling of cases in just 1 week. And then if you look at one of the other big indicators that we keep our eye on, which is the positive laboratory tests, the percent positive laboratory tests also doubled last week compared to the week before and is now at 11%. So this is really alarming that our case count and our percent positive doubled in the span of 7 days. And again, we just want to use this as an early warning sign that, we know that masks and vaccines and distancing and staying at home if you're sick or if you test positive for COVID are the ways that we're going to keep community transmission low and keep us from having another wave of COVID infections. Also want to remind you that right now in the Southeast, more than half of the infections are thought to be caused by the B.1.1.7 variant of COVID, the UK variant, which is more highly infectious, about 1.7 times more infectious than the normal COVID strain. And it has, at least it's the majority of our infections now rather than the parent strain, which could be as few as 10% of the infections that we're seeing around the county. And then the balance, the rest of the 40% or so caused by lots of different strains, including versions of the parent strain. So just again, we had been moving in the right direction, but that has now changed. And what I keep telling people is, counts are still low, but caution should be very high. So please, vaccine is the best way for our community to seize the moment right now that we have to stop spread of COVID. And please, we need everyone to get vaccinated, regardless of age, regardless of race and ethnicity, regardless of sex. We just need everyone to get vaccinated to protect our entire community. I heard a lot this weekend, I'm a pretty healthy person, like I don't really need to get vaccinated. Okay, I get it. If you want to risk your own health, that's on you. But by not getting vaccinated, you potentially become a carrier of COVID to others in the community. You may get infected with COVID and not know it and spread it to others without knowing it. So even if you don't, you take your own health, you deal with your own health in risky ways, please protect your parents, your grandparents, your aunts and uncles, other people in the community that you could unknowingly transmit COVID to if you were to become infected with COVID-19. So I've had a couple of questions about variants and breakthroughs. So there is information on county level information, I think, on the state website with regard to variants. Not county level. I think it's still state level right now. But suffice it to say that with more than a couple hundred variants identified, every county has had at least one or more variants detected. With regard to breakthrough cases, so a breakthrough case occurs when someone who is fully vaccinated gets COVID. So this is if you have had 2 shots and 14 days have gone by, or 1 shot and 14 days, you're considered fully vaccinated. You can still, a small number of those people will still get COVID. We know that, right? Those are what we call vaccine breakthrough cases, and the state is tracking those. There have been a couple hundred documented, and I don't believe it's being shared publicly on the state website right now. alabamapublichealth.org is where that information will be shared first. So as soon as they begin sharing it publicly, then we can share it. Not a lot of great details, but I can tell you this, of the ones that I know have occurred in Mobile County, they've not been due to one variant or the other variant. We've looked at least 3 cases, and in each of the 3 cases that I've looked at, they were different. Each of them were the different variant, a parent variant, and one variant of interest and one variant of concern. So there appears to be no real pattern. But we know that B117 is the predominant strain in Mobile County already. Okay, before I talk about this week's vaccine events, I'm going to introduce someone from within our agency, Emily Thacker, one of our COVID nurse managers, who's going to come in and tell you her story about why she got vaccinated.
Hi everyone, my name is Emily Thacker and I'm a nurse manager.
Step over.
Okay, sorry. My name is Emily Thacker and I'm a nurse manager on our COVID team over outbreak and outreach, and I got vaccinated in December. And I have a few reasons that I got vaccinated. Number one, my husband, who is not much older than I am, got COVID in August, and he developed pneumonia bilaterally, and he had to be hospitalized, and that was very scary for me. Luckily, he is fine, but also I realized that I have my own risks. Being overweight is a risk, so I thought if I were to get COVID, I may be at risk to get more severely sick than your average person. And also, I got COVID because I am so tired of living with all these restrictions. I'm ready for everybody to get vaccinated so that we can move on and have real life again. I got it in time to fly to Hawaii, and despite being on all those crammed flights, nobody that went with us got sick, and everybody that went, with the exception of my young daughter, was fully vaccinated. So I think that speaks for the vaccine just in itself. But that's my reason. Thank y'all.
All right. Thank you, Emily, for telling us your story about getting vaccinated. So there are reasons to get vaccinated out there for everyone. So if you want to get vaccinated this week, please, we have a first dose Pfizer event going on tomorrow, April 27th. So this is from 9 a.m. to 12 p.m. at the First Baptist Church of Mobile at 806 Government Street in Mobile. So start your vaccine series tomorrow with us at First Baptist Church of Mobile at 806 Government Street from 9 to 12. Remember, all of our events are first come, first served basis, no appointments taken. Don't need an ID, but you will have to fill out some paperwork. Okay, also tomorrow we have a second dose Pfizer vaccine for those who received their first dose on or before April 5th. This is at the cruise terminal from noon until 4 o'clock. Right, this is important. It starts at noon tomorrow, not 8 or 9. It starts at noon. Please help us get the word out by sharing this broadcast on Facebook so that we can try to let everyone know tomorrow, second dose Pfizer starts at noon until 4 o'clock. Again, this is people who got their first dose with us on or before April 5th. And remember, was 16 and over, but still first come, first served basis, no appointments. Bring your vaccine card. Bring your vaccine card to help the process move as smoothly as possible. All right, so I will leave it with that. I do want to remind you of something. One of the things that our health officer, Dr. Eichhold, has been reminding me, we really want independence from COVID. We want to be able to live our lives as normally as we can. We want our friends and families and churches and social networks to be able to do the same thing. So think about helping our community get independence from COVID by getting vaccinated before Independence Day, right? Please, particularly if you're in that 16 to 50 age group, we need all of you taking time out of your schedules to go get vaccinated so that we can have an entire community independent from COVID by Independence Day. So thanks, everyone. I'm going to be out a few days. The end of this week and first of next. So someone else from the health department will be stepping in for me. So I will not see you again probably for a week or two. So stay safe out there, everyone, and get your vaccine.